Hair loss impacts nearly 50 million men and 30 million women in the U.S. So what is the solution? While hair transplant surgery is growing in popularity, it's not the only option out there. Alfie and Mariah from Utah Facial Plastics are here on the show. We're discussing non-surgical options. But Alfie, I want to start at the beginning. What causes hair loss?
So there's a lot of things that cause hair loss, from autoimmune disorders, hormone deficiencies, vitamin deficiencies, stress. There's also female and male pattern baldness that's caused from a hormone DHT. It shuts down the follicle and kind of makes it go dormant.
So we just did the numbers, and more men deal with this than women, but women deal with it too.
For sure, yeah, we all deal with it. And Utah Facial Plastics deals with it on all scales of it, you know, from natural remedies to hair transplants.
So where do you start when you see a patient, and how do you know where to tell them to start?
So it really depends on the patient too and what they're wanting to do. Finasteride is a really good place to start. It's medication that our physicians prescribe.
What does Finasteride do?
It blocks the hormone that causes hair loss.
So it keeps the hair in your head where
it doesn't help,
it
doesn't grow hair, but it stops the hormone from shutting the follicle
Okay,
down.
so my husband went into Utah Facial Plastics and he started taking Finasteride to hold on to his hair. And what was so interesting, Alfie, is talking to his friends, how many other men are saying, wait, I take that, or what are you taking? I want to take it.
Right, and women take it too. And then there's also shampoos, like there's natural things that you can do, over-the-counter things that you can do.
Okay, so Mariah, that's where you can start. What else can you do that makes your hair look more full?
Yeah, so we offer scalp micropigmentation.
What is that?
So it's scalp tattooing. So it's a really good alternative for our patients that don't want the cost or the expense of surgery. So what I'm doing is I'm doing tiny micro dots to the scalp, and it's going to look like a little hair follicle.
So when you say tattooing, right? This, I mean,
look at
actually, it's artistic.
Yeah.
This is not just a color that you're putting on their head.
Right. So we just go in and insert these little tiny dots, so it creates the look of a fuller head of hair.
Isn't that beautiful?
So wait a second, that's not any new hair, actual follicles.
Right, yeah.
That's just the tattooing.
Right. So this lady, she did have 2 hair transplants before, but we couldn't do any more just because of the laxity of the scalp. So that's where we go in and just dense up the front of the hairline.
What colors are you using?
So for women, we match the hair color that they dye their hair, or their natural hair color. For men, it's always black or brown.
And how many treatments does a patient typically need?
Depends on the surface that we're covering, so it could be anywhere from 1 to 4, sometimes a little bit more.
Alfie, where are you in the hair process when this is something that's right for you? Have you lost a lot of hair, a little bit of hair?
Where am I?
No,
where,
with a patient that would, a patient, no, you have amazing hair. A patient that would need, or a patient that would be right for.
A patient that's, the follicle's completely shut down, so they're not going to grow the hair. That's who's, and then people that do have the follicle and it's just going dormant and they're thinning, we can do PRP, which is
that?
So that's growth factor from your blood. So I draw your blood, I take your growth factor and inject it into the scalp. That stimulates the follicle and like wakes it up and helps strengthen and lengthen the hair.
This is so interesting. I had no idea there were so many different options. And then you go to the other end of the spectrum, which is neograft. My husband just had that done 3 months ago. I want you guys to come back.
Is he happy?
And talk about that. So far, so good. He
good.
is so happy. There's a special that you guys have for our viewers right now. Look at your screen, everybody. 3 PRP injections. You get the 4th free. If this is something you'd like more information on, go to utahfacialplastics.com or go to our website and we can link you to theirs. I love the artistry that goes into this. It's not just, oh, we have a solution for you. It's we want to make you look your very best.
Yes.
All right, Alfie, good to see you too.
Good to see you. Thank you.